Question number 2, 75-year-old man with 77-year-old man with COVID pneumonia. This is going to be a question really about Remdesivir. Treated with a 5-day course of Remdesivir. Which of the following is false? This is his pre-chest x-ray. His follow-up x-ray looks better, but he's still on 100% oxygen on a non-rebreathing mask and high flow. But which of the following is false about Remdesivir? 10 days may not be better than 5 days. No major drug-drug interaction with tocilizumab. The odds of improvement in the clinical status with 10-day treatment course versus standard of care trended toward, but did not reach statistical significance, and or a 14-day mortality rate was significantly better with Remdesivir than with placebo. So the articles to look at are the ACTT1 study group that was published, 163 patients, randomization. You could see hypertension, about 50% of patients are hypertensive, and obesity is about 37%. That's really what we're seeing. Type 2 diabetes is about a third of patients. And then you can see this ordinal scale. So 4 would just be requiring ongoing medical care, but not oxygenation. 5 is oxygenation. 6 is advanced oxygenation. And then 7 would be receiving mechanical ventilation. So the overall improvement of the proportion recovered would be Remdesivir was better than placebo. Let's look at this number here. Median time to recovery, 11 days versus 15 days. 11 days with Remdesivir versus 15 with placebo. And that was statistically significant. However, 14-day mortality, even though it's less with Remdesivir, 7 versus 12%, it's still not statistically significant. Confidence interval passes 1. In terms of the subgroup analysis, you can see that the ones receiving mechanical ventilation, Remdesivir really did not necessarily help. However, the one receiving oxygen, that's really where you see the greatest benefit. The next study, Remdesivir for 5 versus 10 days with severe COVID. You just point out that there's really no difference between 5 and 10-day course. Day 5, 7, 11, 14 in terms of recovery is really similar. And actually it looks even better with the 5-day group than versus the 10-day group. And another thing to mention, nausea is about 10% of patients who are on Remdesivir. AST and ALT elevation is really not that high, about 5 to 10%. And then there's this SIMPLE trial, phase 3 SIMPLE trial, hospitalized patient, looking at 5 versus 10-day course. The 5-day Remdesivir treatment group, 65% more likely to have clinical improvement with day 11 compared to the standard care group, and the p-value was significant. The odds of improvement with the 10-day treatment course was also favorable, 1.3 times more likely to be okay, but the p-value was not significant. Again, 5 is actually probably better than 10. So which of the following is false? 10 days may not be better than 5, certainly. No major drug-drug interaction. The odds of improvement in the 10-day treatment course of Remdesivir versus standard care were favorable, but did not reach statistically significant. 14-day mortality was significantly better with Remdesivir than with placebo. That is false. Actually, it was 7 versus 12%, but that was not statistically significant. I hope you enjoy it. Thanks. Okay, and you stop this right here.